An arbitrator awarded a pay increase. That's good news, but it's not necessarily their first concern at this point. The pay increase is over a couple of years, 5.25%. The first year is 3%. The second year is another 2.25%. But the terms of the contract with the hospitals do not include minimum staffing levels. The terms of the contract basically it means that the staffing levels are not for patient care. That's what the ONA has said at this point. But they say their first concern in and around that is their own safety. Safety is one of the things that we've heard about in the past, and that when dealing with patients, when dealing with other people, that sometimes they're put in harm's way. They say they deserve the same safety in numbers as other frontline workers, like firefighters, for instance. The hospitals argued in this case that the union's staffing ratio demands were too rigid and unrealistic. The arbitrator also said in the decision that the nurses were raising concerns about workload and the appropriate staffing levels, but there are mechanisms in place. I had a chance to speak with the Nurses Association president this morning. Here's what she had to say about those safety concerns.
You see nurses responding to dangerous situations that are life-threatening, and they are doing it on their own. What we're seeing is, and the evidence shows, that staffing ratios provide safer work environment, but not just for the nurses providing the care, but it's also safer for patients. So it's a win-win. And I don't know why this arbitrator would decide that it's not, or that the Ontario Hospital Association would say that it isn't.
The union at this point has said they're going to consider next steps. What that may be, they're not 100% sure, but they will be talking about potential legal steps at this point. I want to point out that this report was released a couple of weeks ago. It was put together by the Hospitals Union Association plus CUPE, that's the hospital's arm, basically saying that staffing levels, nurse to ratio levels, is important, obviously, to make sure that the patients get that much more care. They've put this together. They've released that as well. It's another argument for those staffing levels. This morning, I reached out to Health Minister Sylvia Jones's office. We have not heard back, but we have heard repeatedly from her that more nurses are, in fact, being hired. That's good news from the province's standpoint. Whether or not they're put in place in those hospitals is another thing altogether.